Okay, should I start presenting?
Yeah, when you're ready.
Hmm.
Yep, 1 second.
Hi
Um,
everyone, my name is Brandon, and today I'll be presenting on my project OmniCare AI. Without further ado, let's get into it. First, I'll introduce the idea behind OmniCare AI, then I'll explain the problem I'm trying to solve, and then share some real-world statistics, and then share the solution, and afterwards I'll show a demonstration via video.
cool. Pause 1 second. Brandon, look, the demonstration is supposed to be live, right? Does that make sense? Not the
Huh?
video. The demonstration you're meant to just show your app directly rather than
Yeah,
the
no,
video.
it's live.
Okay, cool. Okay.
Wait, is it a live one or is it like because I have the video, or should I show it live?
No, just show it live. Look,
Okay,
you're
okay.
on a call, right? It's best to show it
I'll have
live.
to,
I can ask
so
you
I'll have to
questions.
go to the app myself.
Oh yeah, you have it ready, right?
Yeah, let me open it.
Very best.
Let me open it.
Click projects. You're in
Deployments.
JPEG. Oh, that also works, yeah.
And here, yeah. And then visit. Yeah, okay. Good to know.
Perfect. Yeah. Please,
Good to know.
ready. Get started.
Okay. So the mission of OmniCare AI is to empower and support modern hospitals, departments using real-time artificial intelligence, which would assist it and help it in everyday tasks.
Okay.
Currently, emergency departments are often overwhelmed by by the amount of patients that they receive. Some of these visits aren't even necessary, and while other patients need immediate care, but they have to wait longer. The solution is an AI-powered program that can triage or like sort patients, analyze wound photos, and evaluate symptoms from home to categorize if they need to go in to see a doctor immediately. One problem is that emergency room staff are often overwhelmed by patients who do not need immediate care, while patients with true emergencies have to wait longer and they risk their mortality rate. Another problem is that patients at home have no easy way to monitor whether a wound is healing properly or getting worse. Therefore, they don't know if they should go in or not to the hospital. Finally, many people do not know how urgent their symptoms are. Some wait too long before getting medical attention, and others go to the emergency room for conditions that could have been treated at home.
Pause 1 second. Go back. Yeah, the first point, no, in the problem statement. Yeah, the first point, basically you're saying there's a lot of people, a lot of patients here who do not need emergency care, but they still show up there regardless, right?
Yeah.
What's the reason? No, most people aren't that stupid, right? They know what is an emergency and what is not, but like, so why do people still show up in the emergency room?
Well, it's not the fact that they have like their problems don't matter. It's just that some matters care more than other. For example, like resuscitation, while other ones, even though they're urgent, you can still categorize them by how urgent they are.
Hmm. All
So
right, no, wait. Be careful here, right? A lot of reasons people show up in the emergency room even though they might not need to is not because they don't not because like their case isn't like important, but because like the ER is like the only place that will see them, right? Because of insurance concerns and things like that. That makes sense,
yeah,
right? Because it's not because they're going there because they don't have a choice but to go to the ER. That makes sense. That's
yeah.
also an important aspect to consider. Okay. Please
Okay.
continue.
All right. What? So some real world statistics. These are 3 to 4 statistics with brief explanations underneath. 60% of ER visits are non-urgent. Up to 60% of all emergency visits remain non-urgent and potentially unnecessary. And that 80% of people self-assess before seeking care. That means people choose self-assessment methods over seeking medical healthcare when they feel unwell. So they don't know if they should go in based on their symptoms, but they just check it themselves, which cannot which is okay sometimes, but it could also be unreliable. 91% would use an AI symptom checker again. So on another AI symptom checker in a survey, most patients reported receiving useful information from their health problems, perceived it as useful for diagnosis, and they said they would use it again. And then chronic wounds cost Medicare up to 96.8 billion a year. 96.8 billion a year. That means 8.2 million Medicare beneficiaries had wounds with or without infections, with Medicare cost estimates for acute and chronic wound treatment. So a lot of patients, they have chronic wounds, which are like short-term wounds that could be treated at home, but instead they have to pay a lot of money just to get it treated when they could when they could combat it with over-the-counter medicines.
Okay.
So here's the solution. This is a picture of the start page of OmniCare AI. It basically gives a summary and it gives you the login. So without further ado, we can get into the demonstration. I have the video right here, but I'll do it live. Oh,
Please.
okay. Can you see this?
Yes, I do. Yeah. Please go
Okay.
ahead. Oh, yeah, one more thing. Can you make this full screen? Do you know how to do that? F11.
F11,
It's
FN.
function key.
Oh, there we go.
There you go. Cool.
Okay.
Please.
OmniCare AI is a smart hospital triage and resource optimization matrix, which basically is a clinical assistant that assists with patient prioritization and
There you go.
pharmacy stock and resource tracking, and also tracking tissue wounds and healing. So I can log in and then let's check this out. You normally log in with Google, but I already have an account, so I just signed in with my Google. So you see 5 main pages here. The first one is the patient intake and triage. This is basically where like the clinician enters data of the patient. For example, we can autofill here. This is like the front desk person, and they categorize them, and you enter it into the system. Then you queue it, and basically it tells you how much of an emergency it is, and then it categorizes like based on ESI 1, 2, 3, 4, and 5. 5 being like the least urgent, so that you get to the ESI ones the most, like the quickest.
Cool.
So you can also have a choice to save to patient, which we have a patient database. I'll go over that later. We also have a diagnosis, which basically a physician will upload a diagnosis so the patient can see it, and the patient can also ask a question if they have a question about the diagnosis, and the chat bot will answer them. And then a view prognosis. This is basically like timeline of recovery. So like how long do you expect to recover and stuff.
Cool.
Patient database. So this is basically just like you have a database of patients. Here's all the patients you can. So you basically, to start a new patient, add a new patient, let's say like Bob, and then like Reyes. You have to enter the age and then gender, and then afterwards it will ask you a bunch of specific details so you can access the information to the patient, so you can reach the patient. So emergency contacts, contact information, flags and notes, etc.
So
So
this
this
stuff will be filled out, the patient database. Who's filling this out?
who fill the physician, the clinician. So there's store the triages and make sure that information does not get lost, because it can save it to the patient here, so that they
Mhm.
know like, oh, this person already has been to the ER a couple months ago for this problem.
Oh, okay, cool, cool. So I guess not the physician, but the what do you call it? The receptionist is going the
The
one who has to
receptionist,
fill
yeah.
this out.
This is a
There you
tool
go.
for the physician will upload the diagnosis though, because the
Cool,
physician
cool. Okay.
will upload the
Yeah,
diagnosis
of course, of
to make
course.
sure that the information is correct. Anyways, so here is the emergency stock control sliders, which basically demonstrates how many materials or supplies is in the system, and how many like is at the hospital and how much you can use. So basically, depending on that, the view prognosis will change. So if I set one of these to like 0 units, it'll find an alternative medicine, since we have none of.
Mm-hmm.
Here's the vision portal. So if you upload an image of like tissue or scarring or like a burn, it'll analyze it for you. I can try this out. Let me upload the here. I'll just search up a burn photo and I'll show you how it works. Photo, image. I can just save image as here, and then analyze image. So it will analyze the image, and it shows see, it comes with a classification, and it basically says it's a localized thermal or chemical injury based on erythema, and the formation of blisters. So it basically gives
All
you
right.
like the diagnosis itself or like analyze. And
So is
yeah,
it like, is this for like the nurses and stuff to like to for like simple stuff that like that they need confirmation on? They can just be like, okay, wait, this looks like a burn patient. Let me find out what kind of burns it is,
yeah,
and then
yeah.
they can immediately add. They don't have to like talk to a physician and spend
Mhm.
waste their time
But
because like a simple burn injury.
it's also used
They'll
for patients. They can track it themselves using their own.
okay,
Like,
cool,
let's say
cool.
how they have
Okay,
like they get burned at home. They can take a picture of it and send it to the AI, and the AI can tell them, oh, it's this, and then
cool,
yeah.
cool. Okay.
So yeah, and then the final one is the at-home symptom checker. It's basically just tells you this like you describe the symptoms you're experiencing. We can do an example. For example, I'll do myself because I have a history of asthma. So 15 history of asthma. And I can type, so I've had an issue where I've had pneumonia after exercising a lot. Let's see if it recognizes the symptoms. I've been coughing up mucus after working out or exercising, doing cardio. My lungs feel inflamed. And then it'll say analyze my symptoms. And basically it'll tell you like an urgency level, like basically soon you should see a doctor in the next 2 days. And also give you possible explanations, but not just a complete one answer. And then it'll give you the recommended next actions. So use your quick relief inhaler before workouts, warm up gradually, stay hydrated. If the cough persists, worsens, or develop wheezing, schedule a visit with your primary care provider. So yeah, it'll basically give you a bunch of advice and it'll diagnose which the disease, or not completely diagnose, but give you possible explanations to why you have these symptoms. And it'll tell you if you need to see a doctor soon. And then if you have any questions, you can ask the AI chatbot down here. But it gives you mainly the recommended next action right here.
Cool.
Yeah,
All
that's pretty
right.
much
That's pretty
Omni.
much it. All right, wait.
If any,
There's like I have one suggestion for you, right? Not really a question. First thing first, how would you improve this app?
sorry, you're
Like
not
one.
audible. You're not audible.
Hello?
Sorry, you
Can
weren't
you hear
audible
me
for
now?
like the last like 5 minutes.
Okay.
Sorry, can you say that again? I
No,
can hear you now.
basically, how would you improve this app right now? There's one big flaw that you have right now.
Um, let's see. In your opinion, what is the biggest?
Okay. Basically, like, look, the problem is like only certain people should have access to certain things. Does that make sense? Like,
Yeah,
you don't want the receptionist to be able to give a diagnosis, right? You don't want you only want if it's just a normal patient signing up to your account, then they should only have access to like a few things, right? They should not other patients' records and stuff like that. Does that make sense? So there's permissions here, right? Like a doctor has access to maybe everything. However, like the receptionist only has access to certain things. Same thing with the patient, right? So when you're signing up, that you're making an account, right? That should be taken into account, and only when according to your permissions, you should be only given access to certain things. Does that make sense?
yeah, that makes sense.